Welcome back to the program as we continue now with my conversation with Dr. Cheyenne Bryant, as well as Los Angeles City Council member Herb Wesson. Dr. Cheyenne Bryant, if you'll come in for a moment with me, for those who are disturbed, like for example, I just got to be honest with you, you're a good friend. I'm disturbed by what I see and how this has adversely impacted our community, primarily because of the disparities and inequities that have existed before COVID-19. We're seeing it during COVID-19. And like Councilmember Wesson just said, we're going to see it beyond COVID-19. So help me, if you will, what do you do from a mental health perspective, Dr. Bryant, to help people not muddle through this, but get through this and overcome this?
Absolutely. To help them not just merely survive, but to thrive in a pandemic like this. And I mentioned this before, Kelly, within our conversation, that the Black and Brown community, they have been experiencing symptom-like pandemic type environments before this pandemic. And so you add this pandemic to an already surviving community, an already surviving race of people, you're adding on 200 to 300% more of stress, of anxiety, of depression. And that becomes really, really heavy. When you have the CDC, who has not released the effects, the disproportionate effects on a Black and Brown community by race. They're giving us numbers as a whole. No, we need numbers by race. We need to know how many of our people are being affected by this, how many of our folks need access to healthcare. That's the information and the data that we need as community leaders so that we can go into our inner city, our hood, and provide the necessary essential care for our people to thrive, for our people to get health care. We've already been experiencing a healthcare disparity that's been sitting on the back burner of the American healthcare system for years. That's not new to us. But again, I've said this, if you know that you have Black and Brown folks that are being disproportionately affected by a pandemic, by a disease, why is it that you're not setting up not only test sites in the heart of these cities, but also treatment? Why is it that we're not having psychoeducational disease education set up in the heart of our cities? Why is it that we're not provided extra funding so that our inner city can have the necessary things like a face mask, as simple as a face mask? Not everybody has access to that. I mentioned this on our local news here. Really quick, I went into a Target, a Black guy had on a ski mask, and he got racially profiled for that. And you know what that young man said? This is all that I had at home to protect myself and to cover my face. Now you have elected officials that are saying, wear your ski mask, protect yourself, protect others. And you come in there with all that you have. It could be a bandana. They've stated this clearly on the news. Wear a bandana, wear whatever it is that you can, a t-shirt to protect yourself. You have a young Black man comes into a store, abiding by the rules, doing what's right, and he still gets racially profiled? No, it's disheartening. And unfortunately, these are circumstance situations that, alongside underlying health issues, become a mental health issue.
We have to redress this and address this, and we have to have you both back on because it's important what you're doing, Dr. Cheyenne Bryant, in the medical community, the mental health community. It's important what you're doing, Council Member Herb Wesson, and what you're doing in terms of representing the second largest city in America, Los Angeles. Now, I know the county has some 10 million people. The work that both of you are doing, public and privately, is so important. And I hear your cry, and that's why I wanted to give you a voice to expanding your message on this platform. I got to have you back if you want to come back next week or whenever to update me on what's happening in Los Angeles, because we cannot afford to lose lives. And to your point, Dr. Cheyenne Bryant, I'm glad you're doing that with the NAACP, stating that we are tired of dying. And just an editorial note on my own, we're tired of dying not only from COVID-19, but from violence. So I welcome you both to come back on. Dr. Cheyenne Bryant, as well as Councilmember Herb Wesson, please continue the good fight.
Well, thank you. And I follow Dr. Bryant wherever she goes. She's my leader.
Thank you, Herb.
She is a good person to follow. Thank you both. And we'll be back with more of the show after this.